When COVID struck, we were told to stay home and stay healthy. But what if you didn't have a home? As every public gathering place closed, where would you go? For warmth, for medicine, for even just human connection? For many people experiencing homelessness, that place to go has been the mobile medical van. In a world turned upside down and strewn with barriers to accessing care, the mobile medical van is a source of stability and hope, meeting people where they are, helping them get what they need, and offering support and kindness, something that we all need and deserve.
If we didn't have our social workers, we wouldn't be able to provide half of the services that we do on here. Social workers are absolutely essential.
I wouldn't know where I'd be without, someone like Chrissy and Elise and Sarah's and Josh. And what really changed me is that, 2 years ago I was in my tent. And it was snowing like crazy outside, and in the tent was overweighed with a couple of 100 pounds of snow, and it just collapsed on me. And it just, there was so much snow everywhere, it just all came inside the tent and ruined everything I owned.
We've worked with off and on for quite a few years. He had been homeless for, I don't know how many years, but it had been quite a while. So I approached him again and said, how would you feel if I kind of re-referred you? And he was open to it at that time.
I was very tired of living outside in a tent. You never knew what was going to happen, what the weather was going to be.
It's housed now, which is great, so he didn't have to stay outside this winter. It took a while for him to get to that point with a lot of support, a lot of advocacy, a lot of patience, and until he was ready to do that, then we just supported him in that decision.
A lot of these folks are so disenfranchised. They are the folks that we don't look at twice. They're not just necessarily coming in for medical care. They need sleeping bags. They don't know where they're sleeping tonight. They don't know where they're getting their next meal. And it's just, you leave the shift feeling like you did something, even if it was just a tiny thing, you're planting a seed. I would love for folks to just use us and utilize the fact that we're out on the streets, we're pounding the pavement, we're with people, we're meeting them where they're at. I just hope that folks can look at our services as an asset and a connection to coordinate care.
When I don't have to do something all by myself all the time, that's very nice. And when I have a helping hand, makes my heart skip a beat. And I'm getting so old that maybe I better not let things make my heart skip a beat. I love them all with everything that I have.